Hi there, my name is Sophie and I'm an occupational therapist. In this video, we will review one example of what the role of an OT could look like in a community setting. Imagine you are a new OT working in the community. You're part of an assertive community treatment team, an ACT team, providing care to people in the community. This video will illustrate the role of an OT on an ACT team and will teach you specific skills on how to implement grounding techniques as part of a mindfulness-based practice. First, a brief reminder of what an ACT team is. ACT is a multidisciplinary team that provides 24-hour mental health care in the community. The populations that an ACT team works with tend to be unsuccessful with other treatment options and often experience repeated hospitalizations. The role of an ACT team can vary depending on the community. However, the general role is to provide support and skills training to prevent negative health outcomes or potential rehospitalization. The population you are working with on the Community ACT team are women living with borderline personality disorder, also known as BPD. BPD is a mental health condition that affects up to 3% of the general population and accounts for approximately 10% of the outpatient psychiatric populations. BPD symptoms are characterized by difficulties controlling behavioral impulses and regulating their emotions, difficulties managing their interpersonal relationships, unstable self-image, recurrent suicidal threats, behaviors, or self-mutilating behaviors. These symptoms may lead to frequent hospital visits. As a member of the ACT team, you will work with individuals, such as those with BPD, to find better ways to manage their symptoms so they can remain in the community. Parenting, among others, is one occupation that is affected by BPD. Mothers with BPD report feeling estranged, anxious, overwhelmed, or even angry with their infant from birth. They have difficulties in accurately interpreting their child's affect, which leads to high feelings of stress and can make mothers feel less competent and capable with their occupation as a parent. As an OT, you may choose to use dialectical behavioral therapy as a theoretical framework to help inform your practice when working with people living with BPD. The premise of dialectical behavioral therapy is that the experience of severe stress and anxiety causes a breakdown in the mind-body connection, which then prevents the mind from calming the body, leading to emotional symptoms mentioned earlier. There are 4 stages to dialectical behavioral therapy that aim to address this issue. Stage 1. Help clients to decrease life-interfering behaviors and increase behavioral skills such as mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness. Stage 2. Once the client's behavioral dysfunction is managed, clients' emotional problems such as feelings of misery can be addressed. Stage 3. OTs will assist clients in acquiring living skills in areas such as education, employment, interpersonal relationships, or things that they want to do in life. Stage 4. Promote value and acceptance of personal struggles while acknowledging life's difficulties. Mindfulness is one skill that we can teach this population to help regulate emotions, which can enhance their ability to better parent. Grounding is a technique to help maintain a state of mindfulness and stay in the present moment. OTs can teach clients grounding techniques to enhance the development of mindfulness skills. This is a great tool for clients to have in their toolbox. One grounding technique I will walk you through today is called Breathe, which is a part of the Trauma-Informed Practice Guideline. But wait! Before beginning, make sure you've spoken with your client to learn what is working for them now or what has worked in the past. Be aware of the language you use, as some phrases or words may be triggering for clients. It's also suggested that individuals keep their eyes open during the grounding exercises, as this helps support the connection to the present moment. We will now begin the guided breathing exercise. While still noticing your feelings, let's now include into your awareness the soothing feeling of your breath. On your next inhale, breathe through your nose. Notice the stirring of breath on your upper lip, the temperature of the breath in your nostrils, the touch of the breath in the back of your throat. On your exhale, notice your emptying sensations and the natural pause between when all your breath is out, but before your next inhale begins. Continue to breathe in and out, noticing all the different sensations and contact points of your breath with your body. Continue to notice the sensations of breath. Notice now the natural pause after in-breath and the natural pause after out-breath. Breath comes in and goes out in its own rhythm. Now let's take a 3-part breath. Starting in the belly, relaxing and filling your belly on in-breath, filling your ribs and lower lungs, and now the upper chest. Breathe out with a long, slow breath, emptying in reverse order. Now the upper chest, now the ribs and lower lungs, now the belly. Continue breathing this 3-part breath at your own natural rhythm, with no strain, relaxing every muscle that does not need to be working. Now that I've guided you through this grounding technique, it's your turn to try. Once the instructions come up on the screen, pause the video. When you're ready, click play to begin the next technique. Good work! Now before finishing this video, it's important we discuss some challenges associated with using dialectical behavioral therapy. Using dialectical behavioral therapy on an ACT team as a guiding theoretical framework can help to inform your practice. It can help structure how to treat individuals living with BPD and train clients to use mindfulness skills. However, there can be some associated challenges that you should be mindful of. Dialectical behavioral therapy requires additional training and may be costly. As such, current ACT team members may simply choose not to use this kind of theory to inform their practice. As well, dialectical behavioral therapy takes time to implement. Staff may be unwilling to commit their time due to their heavy caseload. Additionally, the abstract nature of mindfulness could make it difficult for clients to understand and apply to their daily life. Finally, while not specifically related to theory or training skills, as a member of the ACT team, you're working with individuals on a daily basis who experience dysfunctional behaviors and labile emotions. As such, you may be at risk for care provider burnout. Despite these challenges, you may still be able to use dialectical behavioral therapy, mindfulness skills, and grounding techniques. However, it is your responsibility as an occupational therapist to use clinical judgment and meet the required competencies in order to provide the best care possible for your client. Thank you for watching this video. We hope it was informative. For more creative OT videos, hit the like button and subscribe below.